I'm Dr. Angela DeRosa, and I'm an internal medicine specialist, but my primary interest in treating women and men is with hormonal health. And first and foremost, I want to get it out there right away that everybody has been very afraid of hormones, and the reason women and men end up on my doorstep is because they've been largely given bad information and they're afraid of hormones and they want some education. And also they've developed a lot of symptoms where other providers are telling them that they shouldn't be going on hormones because of the dangers. So let's go back to where that started. In 2002, Newsweek magazine splashed all over the media that hormones are killing women and we should get off of them. Immediately that day, probably half of the world of women stopped taking their hormones. And thousands of calls were going into providers' office every hour. But the problem was with that study is they basically scared the crap out of women. They told us that hormones were causing breast cancer and that it was going to kill you by basically hurting your heart and cause heart attack, stroke, and blood clots. Well, what was interesting about that study, it was done on a very bad synthetic, Prempro, and it was also an oral medication, which are truly not safe for women. If you're going to prescribe hormones, you should do non-oral, such as creams, gels, troches, rings, or what we specialize in, pellets. So let's figure out what went wrong with that study. So number one, they said that breast cancer was increased 26% and a 41% increase of stroke in those women. But the problem was 8 to 10 years later, they actually went back and looked at the statistics, and lo and behold, it said absolutely no, there was no increased risk of breast cancer, but where was the media shouting that from the rooftops? The other thing that was interesting, the Premarin arm alone, which is just estrogen, which is a conjugated estrogen made from horse's urine, not a great product, but even in that worst product that you can give women for estrogen, it showed a decrease in breast cancer by 23%. Again, where was the media talking about that? All they wanted to do was scare us into believing that hormones were bad for you. Well, in our practice, we specialize in hormonal health. I do not prescribe Prempro, I do not prescribe Premarin. What we prescribe are non-orals, so things that are not taken by mouth, and we prescribe bioidenticals, which are way better for women and are actually healthy for women and decrease your risk of developing chronic illnesses such as heart attacks, strokes, diabetes, and more importantly, they make us feel good because they prevent the hot flashes, night sweats, and all those terrible symptoms that we develop. So I wanted to walk you through the different types of hormones and explain why we may prescribe one over the other. The first thing that most commonly providers will prescribe are oral therapies. So for instance, Loestrin is a low estrogen oral medication. One of the worst things you could probably do for most women, again, there are some women that may benefit from this, but for most women it's a low estrogen medication, and frankly, low estrogen doesn't mean better. It is actually worse for women because it has a high progesterone, which is the PMS hormone, and we all know how that makes us feel, and low estrogen. So we want to flip that ratio. So if you're going to use orals, make sure you're high estrogen, low progesterone. But the other thing that oral medications do is they process through our mouth. They go through our liver, and when our liver deals with them, they actually kick out a protein called SHBG. That protein binds up other hormones. Its favorite is estrogen and testosterone. So in order to overcome that effect, you have to raise the dose, which can often lead to toxic side effects. The other thing that it does is whenever you take an oral medication and process through your liver, is goes through your liver and creates clotting factors. Now, clotting factors will indeed increase your risk for heart attack, stroke, and blood clots. This is why I primarily do not recommend orals for women, because they do in fact increase that risk. They are not healthy for women. So there are other options that you should be using. Again, you have creams and gels, which actually are good for both men and women. You have patches, which actually we place on the skin and do a slow delivery through the skin. And you have rings, which can go through the vagina and increase the hormones. That's more for contraception than hormone replacement. But what we specialize in is this hormone pellets. And pellets go under the skin, right about here, and they do a slow release over time in delivering bioidentical hormones. All of these other types are safe. They do not process through the liver, therefore they're not going to increase your clotting risk. The main differences between these types of medications, or replacement as I like to call them, is how they get delivered and how they get absorbed. First and foremost, creams and gels. They absorb very rapidly, so you rub them either on your wrist or bikini line if you're a woman, or in men they may have various things such as under the arms, on the shoulders, but they spike doses and come down. So every day your levels are going up and down. So you're more apt to get side effects when it's at the high dose, and you might be low half the time because it's underneath that baseline. We want hormones to be even. So the creams and gels actually go up and down every day, therefore providing not a consistent dose of hormone therapy, but again, a safe way to deliver it, just not as effective. Now patches are nice because you can put them on the skin and they do a slower release. So they come up and they come down. So it's more like a roller coaster effect over a period of a week. But the problem is here in the United States for women, we do not have a testosterone patch approved. It's a whole other video we can get in talking about the government and how they're really discouraging testosterone for women, but the testosterone patches are approved in Europe for women. But I like patches because you can provide that steady relief. The problem is that unfortunately I only have an estrogen to work with and not a testosterone. Again, why we love hormone pellets is the pellets can provide estrogen and testosterone for women, or testosterone just for men. We don't want to be putting estrogen in men. But certainly once we get those hormone pellets under the skin and delivering a slow release, the hormones go very even over a period of months, anywhere from 3 to 5 months for women and anywhere from 5 to 6 months for men. It provides a nice steady state, again, very even, so we don't get the side effects typically. It lasts a long time, so you don't have to worry about taking creams, gels, and forgetting your medications. And it's also very safe because it avoids that liver. So when we're prescribing hormones, we really, really want to be dealing with the most effective, which is pellets. And obviously, everything we do needs to be safe. So it's our preference to do pellets, but we will do patches, creams and gels, and troches, which we don't have on the tray, which go under the tongue. The only thing we really, truly want to avoid is orals, with the exception of some very minor populations. I hope this information helps.